I think best case scenario is that we really do, between virus-induced immunity and vaccine-induced immunity, we get to a level in the population, this herd immunity, and COVID does truly become endemic. There's middle scenarios where COVID may become seasonal, where we'll see surges in the fall and the winter, or most likely we'll continue to have localized outbreaks and surges in specific areas. And then worst case scenario, which would be if SARS-CoV-2 continues to mutate and somehow is able to combine the contagiousness of Omicron with the virulence of Delta. I don't think most of us feel that will happen, but there's really no guarantee. I think it's reasonable to assume, again, by the end of this surge, 90 to 95% of Americans are predicted to have been exposed in some way, shape, or form, whether through infection or whether through vaccines, to the virus. And so I do think we can expect a respite for at least a few months, hopefully. And if it takes us into the spring and summer, then we also have some environmental factors that can, at a population level, decrease transmission, just more people being outside, kids out of school, et cetera. While the pandemic is still afoot, which it certainly is, we need to continue to wear masks. I think a certain cohort of the population has really realized the benefits of wearing masks, particularly in the fall and the winter, in terms of prevention of other respiratory illnesses like the flu. I think it's really going to depend on individuals' risk tolerance. Interestingly, as we know, certain societies, mask wearing is very common, accepted, and actually expected in certain East Asian societies. I think in the US, again, I think it'll be very variable once we're in the truly endemic phase. The current sensitivities will improve as we learn what areas of the virus to target with these readily available tests. Hopefully, manufacturing will increase such that they are broadly available across all segments of society. And I think it would really provide a nice reassurance where if you are interacting with vulnerable individuals or potentially in large groups, depending on whatever happens with the pandemic, you could certainly incorporate, there are plenty of scenarios in which you could incorporate testing to really continue to do those things we love safely.